And just a reminder, this is our second quarterly student case conference. Sometimes we're discussing cases, sometimes interesting topics, and today a great speaker. And the goal of this is just to give people interested in the field a deeper, more nuanced understanding as they decide whether genetic counseling is a good fit for them, prepare to apply, or even to interview for programs, and then of course, eventually to join a training program. And part of the reason we do this is we want to increase opportunities for genetic counseling exposure so we can try to continue to diversify the field. Because it's really important that the genetic counseling field reflects the patients and communities that we serve, to include men, the BIPOC community, members of the LGBTQIA+ community, and people that are coming to genetic counseling as a second career. So just to get a couple of housekeeping items out of the way, this session is being recorded. And I just want to remind you that you can follow my Gene Counsel on social media so you can learn more about our upcoming webinars and just interesting updates on the field in general. We also have a really good student toolkit on the My Gene Counsel website. So I'm going to turn it over to Michael. He is a genetic counselor, and he's had a really interesting career both on the clinical side and industry side. So he's got some great experiences to share with you. He'll take questions throughout, but will also be available at the end to answer questions about the field in general after you've connected with him with your questions. So take it away, Michael.
Thank you, Megan. I'm going to very quickly share my screen, and then if you'll just, actually I'm getting an error message. It says disabled participant screen sharing. If you could give me host abilities, I think I'll be able to share my screen.
We're working on it now. Sorry about that, Michael.
Oh, no worries.
Hopefully you're good now, Michael.
Yes, I just got the message, so let me share. Okay, can everyone hear me and see my screen?
Yes.
Wonderful. All right, so Megan, thank you for the introduction, and thanks to everyone from my Gene Counsel for inviting me to speak today. As Megan mentioned, my name is Michael Osborne. I am a genetic counselor based out of North Carolina. And I really intend for today's talk to be very informal. So as Megan mentioned, please do feel free to interrupt with any questions. I'm not sure if the typical format is to just, speak and interject or to put something in the chat box, but however is typically done, please do leverage those existing pathways to ask your questions. Megan, did you want to comment on that?
Sure. If you guys all want to put in your questions in the chat box, then we'll kind of be keeping an eye on those. And when Michael's at a good stopping point between subjects, we'll bring those questions up.
Excellent. So Megan, I'll let you look out for the chat box. So again, please just enter your comments or questions as we go, and I'll let Megan interrupt me as we need to. And so I thought for today, I would go through kind of my own trajectory. So my experience as a genetic counselor, what brought me to the field, what I love about it, where I see the field going. And hopefully this will give everybody some insight into, what the genetic counseling field looks like today and how we anticipate it's going to evolve and how you all can be involved. So without further ado, I will start the presentation. So let's see. There we go. So just a very quick disclosure. Of course, I don't work for my Gene Counsel. I do work for a company called GRAIL. However, today I'm obviously not speaking on behalf of GRAIL. I'm speaking as another genetic counselor and also not speaking on behalf of my Gene Counsel. So, again, these are my own thoughts, but I will keep them appropriate. So again, just a little bit about me. I am from North Carolina, and that is where I currently reside. So went to school here as well. I completed my undergrad at the University of North Carolina in Chapel Hill, which is located right in the middle of the state. I actually started off as a journalism major. I have no idea why. I think it was mostly related to the fact that I wanted to be in front of a camera. But here I am now in with the camera on anyway. So I guess it all worked out. But pretty quickly after starting at UNC, I realized that I had a major love for the sciences. Everybody at UNC was required to take intro to biology class, and so fell in love with science, and in particular really enjoyed the genetics curriculum. So I switched from journalism to basic biology as my undergrad, and again as the biology major. As a biology major requirement, I was required to take a genetics course in its entirety, and along with cellular molecular biology, and just really fell in love with the material. I love how quickly it was advancing, even 15 years ago. And so I started looking for different careers or different opportunities where I could take something that I loved, which was the topic of genetics, and then turn it into a career. And so after spending some time on Google and talking to different professions, I stumbled upon the field of genetic counseling. So genetic counseling, of course, is the didactic, the education is learning constantly about underlying genetics and human genetics, human disease. But then also the counseling part means there is some sort of typically a human interaction, what's also really appealed to me. So again, as an undergrad, I think starting my end of my junior or summer between junior and senior year, I actually started shadowing some genetic counselors in clinic. Very fortunate that at UNC, the dorm where I lived was only about a 5-minute block from the academic hospital. And so I was able to contact some genetic counselors there and start shadowing. And that's where I really got my first experience with what a potential role, at least in the clinical setting with patient care, might look like. I see a few chats. Megan, are we good so far? All right. So after deciding to pursue genetic counseling, at the time, there were about 25 or 30 schools across the country that had a genetic counseling program. And there was one in North Carolina, about an hour from where I went to undergrad, so UNC Greensboro. And this is where I ended up attending. And part of the curriculum, again, with genetic counseling program, it is a master's degree. I think most genetic counseling programs are 2 years with the summer in between, and there's a heavy focus, of course, not just on learning the material in the classroom, but also applying it through clinical rotations. And so every school is going to be a little bit different, but at UNCG, most of the first year was in the classroom. So again, learning a lot about the basics of genetic counseling, bedside manner, underlying human genetics and basics of diseases and molecular genetic testing. And then starting the summer in between your first and second year, there's a very heavy emphasis on clinical rotations. And so we typically, again, at UNCG, there were five rotations. Most students had at least one in prenatal or reproductive genetics, one in pediatrics, and one in cancer. And then, there were a handful of others that in diverse settings, or maybe a combination of other specialties that I just mentioned. But again, 5 total. And so for most of the second year, about 3 days a week, you are in the clinic with certified practicing genetic counselors. Of course, they start you off slow with observing or just doing a couple of parts of the session. And then, by the end of the year, you're essentially doing the entire process on your own, but of course, with somebody always available as backup. During that second year, even though most of your time, I think, is spent in the clinical setting, there was 1 day a week in class And then, of course, there is some centers call it a thesis. Some will call it a capstone, but there is a large project that you're working on for completion at the end of the second year. So upon completing my degree at UNCG, I actually again stayed in North Carolina. And my first job was back at UNC, where I completed my undergrad. This I'm specifically mentioning because I think it shows the importance of connecting with genetic counselors and shadowing if this is something that is of major interest to you. You know, again, I understand that things are a little bit complicated right now since we are still in a pandemic, but one thing that really not only solidifies your decision to become a genetic counselor, you know, but also I think improves your chances of getting into a genetic counseling program is that shadowing experience, whether it's virtual, whether it's in person, whether it's connecting with the genetic counselor and talking about the day-to-day. All of that's going to look really, really good on a resume if, again, this is something that anyone is interested in pursuing. And then, of course, it never hurts to network. And so I mentioned that when I was a junior, becoming a senior, I reached out to some genetic counselors at UNC and made the 5 to 10 minute walk to observe a few times a week. And that group, the very first genetic counselors I ever met, ended up being the group that hired me 4 years later for my first job. So again, networking not only you know, potentially has implications for career and grad school, getting into grad school. But, you know, also I think it's very important to just, whether it's genetic counseling or any position, any job, really important to observe it firsthand and make sure that it is something that you would enjoy, that you could see yourself doing day in and day out.
And Michael, we did have a question wondering if you'd heard about any opportunities for virtual networking or shadowing. I know this comes up a lot on our student webinars during this COVID era.
I think, I mean, obviously there's opportunities like this. I honestly think that the best way in a virtual world or in this COVID era would be to visit nsgc.org. So that's the website for genetic counselors, National Society of Genetic Counselors. So again, nsgc.org, and maybe Megan, if you could type that in the chat box for people to see. But you can actually log in or visit the website and then search for genetic counselors in your either in your area or again anywhere, since we're in a virtual world now, and contact genetic counselors that are open to student interactions and shadowing. There actually is a specific box we check off if we're interested in having students or prospective students reach out to us. So for those of us that have indicated that we're interested in those interactions with prospective students, we typically have our contact information. And so I think that's the best place to start. Again, I know that it's a virtual world now, whereas it wasn't for me 15 years ago, but that is how I started too. I started on the website. I started by looking at local genetic counselors who ended up being at UNC, finding their email addresses, emailing, and then we, chatted on the phone and then set something up. So the process would be the same. And then, there's obviously opportunities for, hopefully soon, for being able to observe in person if there's one local, but also many clinics have gotten quite used to, at this point, to meeting on Zoom or Skype or other virtual avenues. And again, it's pretty easy to just dial in and observe. Great question, though.
Thanks, Michael.
Mm-hmm. So I've been, I graduated almost 10 years ago. It'll be 10 years ago next month. So again, my first job was at UNC, seeing patients, and I'm going to talk about each of my positions in a little bit more detail. This is just the high level overview. But after about 3 years in clinic, I switched in 2014 from patient care to working more directly with industry. So working with laboratories, private laboratories that perform genetic testing. So I'm actually now on my third position within industry, but I've worked for 3 different companies now. One called Ambry Genetics, located in California, a smaller company called NextGen MDX out of Grand Rapids, Michigan, and then fairly recently, within the past year, moving to a company called GRAIL, based in California, but with a laboratory operations opening in North Carolina actually this week. So again, I'll go through a little bit more about what my exact experience has looked like. And I hope this gives you just kind of a flavor of some of the many different opportunities for employment there are for genetic counselors. So again, my first position starting about 10 years ago was back at UNC, Chapel Hill in the School of Medicine. And I worked in obstetrics and gynecology, but specifically, I worked in a high risk segment of OBGYN called, what you see at the bottom, Division of Maternal Fetal Medicine. And so maternal fetal medicine doctors are OBGYNs who do, their OBGYN residency, but then do an additional 3-year fellowship just in high-risk pregnancies. And so it's, it can be high risk because of a maternal complication, a maternal condition, or because of something going on with the pregnancy, or in some cases, even both. Again, I was positioned underneath that division of maternal fetal medicine. Typically, the patients that we saw, let me back up just one little step, 95% or maybe even a little bit more pregnancies are, smooth sailing. And so at that time did not see a genetic counselor. But for the small proportion of patients where, again, there was some sort of risk factor identified, typically they would meet with a genetic counselor. That could be something like maternal age. We know that as a woman's age increases, the risk for certain genetic abnormalities does increase in the baby as well. It could be that a routine ultrasound at an OBGYN office revealed birth defects or other concerning findings in a pregnancy. It could be that even that the mother herself has a genetic abnormality and there's concerns about passing that along to the pregnancy, or are there delivery complications associated with having that genetic condition? And so those were the types of patients that we saw. Again, very fascinating. I feel like working at such a very busy clinic and a very high patient volume. So seeing somewhere around, I would say 70 to 80 patients a month. Perhaps that doesn't sound like a lot, but we are spending about an hour with each patient because there's just so much material to cover and so much information we need to gather. And again, since all of these are high risk, there typically was some research involved before many of the patients were seen, lots of documentation afterwards, and many referrals. So it was a very busy, very busy clinical setting, but very, very fascinating. We're seeing very rare scenarios that at certain institutions where it's not high volume, you might read about it but not see it firsthand. So I was able to take all of the didactic, the book learning that I had received over the past 2 to 3 years, and then really start to see those real life examples of the rare conditions while in clinic. Of course, with genetics, you can imagine if you're working in a high risk center, there is the, scientific curiosity driven, fascination with what you're seeing. But, we also have to keep in mind that these are patients and they're dealing with oftentimes crisis situations. And, so that is one thing to keep in mind with genetic counseling, that sometimes there is the delivery of bad news. And so that certainly is something we, as a profession always talk about, is how to, remain present and empathetic with your patients, but also not not let that stress wear you down to where you can't do your job effectively. I guess I'll also say that a great thing about starting off a career in clinic, and especially at an academic center, is that about 50%, maybe about 60% of my job or of my role was that direct patient care and all of that follow-up. But working in an academic center in the School of Medicine, I also had many other responsibilities. So UNC has a small but busy laboratory. So they do some genetic testing in-house. So some of the basic tests that are run on almost every pregnancy are performed in-house. And so the genetic counselors would take turns performing laboratory functions. So again, calling out positive results or reinterpreting results as information changed. And of course, there were always, in an academic center, always opportunities for teaching medical school classes, which I really enjoyed. Student observations. We actually were a site for genetic counseling students who would come and do those rotations with us. And then, publication opportunities. I'm going to take a quick sip of coffee. And, I will encourage for anyone that is thinking about going into genetic counseling, again, there are many opportunities now, and I'll talk about this in some future slides. There are many opportunities for an individual with a genetic counseling degree outside of clinic. I typically encourage people to at least try a clinical position first, even though even if you know that your passion is in a different arena. I think there's real utility to finishing grad school and having a little bit of experience, if at all possible, directly with patients. It really gives you a perspective on the human aspect of what we're doing every single day. Questions or thoughts right now, Megan? Or should I keep
Just had one related to licensure. So in North Carolina, did you have a license? And if not, how did you work with physicians and other team members? And then we got another one that might be better when we get to the industry.
Okay. So yeah, every state at this point, licensure is state by state. And North Carolina does not have licensure at this point. So I can't, and still doesn't. So I can't answer that question, unfortunately. But all of us, there is, again, the NSGC, the National Society of Genetic Counselors, is one of our governing bodies. We also have the American Board of Genetic Counselors, ABGC. And so there is a national board examination that is administered by the ABGC. I believe it's twice a year now, but 10 years ago or so, it was once a year. Again, once you graduate with a Master's of Science in Genetic Counseling or something along those lines, and you can immediately start working. Most people will get a position, and then within a year or so will sit for the board exam. So you're working for that first year, learning a lot on the job. And then again, I'd say at least 95, if not more % of people within a year will sit and take an examination. It's on the computer. I believe 200 questions, and that's how you get the CGC at the end of your name, that certified genetic counselor. So that is something, again, it's not a requirement in North Carolina since we don't have licensure, that CGC, but it is something that individual positions almost always expect to see. So again, I think it's, even though there's not like again, that formal requirement, expect to sit for that board exam. You definitely should just prepare for that to be part of the process. And I think with states that do have licensure, that I mean, there's a little bit of an application, but my understanding is that basically they look for you to pass that board exam, and then, you get fingerprinted and fill out an application. But basically it's the same thing, just with an additional state application. Is that what your understanding is, Megan?
Yes, and we just went through this in Alabama, and I got licensed. And the main thing, like Michael said, that they were looking for is that I graduated from an accredited program, that I had taken and passed the board exam, and then just basically filled out some paperwork. And then I would just add that whether you're licensed or not licensed, you still have a lot of kind of teamwork aspects working with physicians and other providers, and it just may change whether you can order tests or not. And even in states with licensure, there could be rules that will or will not allow genetic tests or genetic counselors to order genetic tests. So it's really on a state-by-state basis.
Yep, I know in North Carolina, and again, all of this is evolving, but in North Carolina, I saw patients on my own. I did all of the documentation and the referrals on my own, but a physician always had to sign. So basically, once I wrote my documentation, it got routed to the physician that was there in clinic with me that day. Now, again, I saw patients separately, but there was always a physician typically interpreting ultrasounds, and they signed off on them. However, in terms of ordering genetic testing, I could order that on my own. And the only time that, they're the same, I'd say 5 to 7 tests were ordered 95% of the time. So if it was one of those very common 5 to 7, I just kind of ordered it. And then if I did something a little bit out of the ordinary, then at that point I would run it by a physician, and then typically just, for that added level of protection, have them co-sign with me. But one of the things that I really loved is, again, I'm working with physicians who have lots of training. It's medical school, then 4 years of residency in OBGYN, and then a 3-year fellowship to become an MFM. But we were considered the genetics experts. And so if I went back and said, I want to order testing for this obscure condition that, no one had ever heard of, they didn't ask any questions. It was just ordered. So again, unless you're working, of course, with another doctor who is a geneticist, in most of these clinical settings, you will be the expert that is consulted. All right, so I move now to my industry experience. So again, in 2014, I would say about this time was when there was kind of a shift in the field. Prior to 2014, 13, there weren't a lot of industry positions. So most genetic counselors were in clinic, and then our methodologies for performing genetic testing changed very, very quickly about 10 years ago. So again, without getting into too many of the nitty gritty, essentially about 10 years ago, we went from only being able to test for one gene at a time, and recall we have about 20,000 in the body. So it was a very slow process, very expensive if you're only doing one at a time, but new methodologies were developed that suddenly allowed us to test for tens, hundreds even of genes at a time. And now, of course, we have, whole genome sequencing that is available. And so as genetic testing really took off and the complexity of genetic testing increased, suddenly there was a need for genetics experts working within these laboratories to provide clinical support services, so essentially clinical advice or interpretation to hospital systems or to physicians or even other genetic counselors that are ordering the tests. And again, we can, and again, that really, or I guess the burgeoning of this industry demand really correlates with the advances in genetic testing and our understanding of human genetics over the past decade. So as I mentioned, I've had 3 different industry roles. With all of these roles, I have been working as what's called a medical science liaison. And so a medical science liaison is, as I already mentioned, almost like a consultant, if you will, or a clinical support service provider for different hospital systems or clinicians or other healthcare providers that are ordering genetic testing on patients. So they're now the ones seeing the patients and ordering the tests, not me. And they're sending it to the lab for which I work. But then again, with the complexities that now have arisen with genetic testing over the past few years, oftentimes there will be results that require a little bit more explanation or perhaps some some additional education before it can be successfully implemented in a hospital system. And so that's the role that I now serve, or that I now provide on behalf of these companies. So there's a lot, and whenever a hospital system or a clinician is interested in bringing on genetic testing, especially if it's something relatively new, typically I am brought in to provide that education on, this is the test that we're offering. This is how it works. These are the patients which would likely benefit from it. So again, making sure that all of the providers, from the CNA and nurses all the way up to the ordering doctor, are familiar with the process, have a basic understanding of how results will return or when it's appropriate to order the test. And then also understand, that I am a resource. Most of the time, the results will come back in a manner that they understand. But again, genetics is complex. And so when there is something that they haven't seen before, or that requires, perhaps a consult, bouncing around ideas about next steps, then I'm available to help with that as well. So I don't specifically work with patients, but I can certainly talk to the providers of patients and provide my input. So my first position, as I mentioned, was at a company called Ambry Genetics. Ambry's been around for about 20 years, and they actually got their start by doing genetic testing in cystic fibrosis. I believe that they were the first clinical, so not research or academic, but the first clinical laboratory that was doing that started doing genetic testing for cystic fibrosis in 2000, 2001. However, again, genetics has exploded since then. And so I was actually brought in to do several different aspects within Ambry. So I worked in cardiogenetics, so heart-related disorders. Typically with cardiogenetics, we think about a few different things. There can be heart defects, but also there can be abnormalities in the structure of the heart, something called cardiomyopathy, where the heart wall itself is abnormal, or arrhythmias, where the heartbeat is not following that typical, lub-dub pattern that we think of. So I worked in, as I mentioned, cardiogenetics and neurogenetics. So specifically within neurogenetics, quite a bit of autism research, but actually most of the testing that was performed was actually in the area of seizures and epilepsy. I mentioned that there has been a lot of advancements with genetics over the past decade. And what I really enjoyed about neurogenetics was that neurogenetics is a field where treatment had not completely kept pace, but had followed closely behind our advancements in genetics. We might understand what causes a disease at this point, given all the advancements in genetics over the past 10 years. But unfortunately, creating cures or therapeutics or interventions, that takes additional time. And so we might be able to diagnose something, but then in many cases, we can't do anything about it, or at least not right now. And with neurogenetics, understanding the underlying reason for a patient's epilepsy or epileptic attacks, in many cases has immediate therapeutic implications. So you should try this medication, or you should definitely avoid this medication, or sometimes even changing a patient's diet would solve their seizure problems. And so again, I really found neurogenetics to be fascinating because it was something new for me, a new field, even in genetics, where we really, we did not learn about seizure epilepsy in grad school. So again, it was a new application of the skill set I had learned as a student, but then also to be able many times to give results that immediately changed a patient's trajectory and their outcomes was very rewarding. And then finally, also at Ambry, I believe was also the first commercial laboratory, if not the first, the second, but one of the first to start offering something called whole exome sequencing or diagnostic exome sequencing. So you can think about this as whole genome sequencing, but really only focusing on the areas that exons. You all probably remember exons and introns were previously called junk DNA. We don't like that term anymore. But the reality is we still don't know what most of the intronic information does. And so whole exome sequencing is, again, focusing on the entire genome that we, that is made of those exonic or the exon material, so without the introns. And that was, that's a, I mentioned that we previously had to test for one gene at a time, and then there was the ability to test for tens or even 100 genes at a time. And then with whole exome sequencing, suddenly we're able to, cast a very, very wide net and look for even previously undiscovered causes of genetic disease in patients. Questions or comments, or should I keep going?
Whenever you think best to answer, someone did ask, how did you know when you should change from one industry company to another? So probably a good segue.
From one industry company to another.
And then another question that might be better to answer first, clinic to industry transition, and then switching companies within industry.
So one really great thing about genetic counseling, again, if it sounds fascinating to you, if you love genetics, is it is a career that has been in high demand ever since we graduated, and that demand continues to grow. And with every position that I have had, with the exception of the first, which I had to apply for, but with the other three, people have come to me. So I will say, as a genetic counselor, it's very common to be approached by different institutions or recruiters and say, hey, we noticed that you have experience in X, Y, and Z. Are you interested in taking that skill set and trying out this? And so frequently opportunities are presented to you for and then you can individually vet. Does this sound like something I'm interested in? Am I happy? Obviously I don't jump ship just for just for fun. But if you're looking for a new experience, they are frequently presenting themselves to you. I would say that how I knew that it was time for me to move from clinic to industry. Again, I do think there's tremendous value in the clinic work and getting that firsthand patient experience. So you never forget that there is a patient life, a pregnancy or quality of life attached to every single genetic specimen that is received. But for me, as I mentioned, it is a lot of in that high risk pregnancy setting. It was a lot of news that was quite devastating to families, and that did take a toll after a while. And that's when I knew that it was time for me to consider something outside of patient care. Now, I will also say that I've had many colleagues and friends that have been in patient care for decades and still love it and still thrive on it. So, I'm not saying that we're all destined to experience that, but that was kind of the pivoting moment for me, that I was starting not to be able to leave that the sadness, I guess, of some of those conversations at home, and it made it difficult for me to do my job effectively. I was there to be there to, I was there to usher patients through that experience, not to experience it with them. And so that's when I decided to make the shift to industry. I specifically was recruited by Ambry, but I was drawn to Ambry specifically because of the exome sequencing. Again, that was just, it still is pretty cutting edge, but I was really drawn to the idea of, for families that had, been trying to figure out, I worked with families that had a 25-year-old child and children in group homes that had been tested for everything you could imagine under the sun and never had received a diagnosis as to, the symptoms or the reasons for the particular condition. And then whole exome sequencing was ordered and we were suddenly able to provide an answer. And I found that very satisfying. Of course, not always, but a very large percentage of the time we're able to find an explanation. And then in terms of switching between industry positions, as I mentioned, it's pretty common to be approached for new opportunities, and so I think it's always I think it's always a benefit just in life to keep an open mind. And so I even if I'm deliriously happy, I will take a look at what the recruiter is or the company is developing or has launched. And if it sounds like an opportunity that's too good to be true, or that I would kick myself if I passed up, then I consider applying. And were there a few other questions coming through, Megan?
Yes, one is, has anyone heard of any positions in industry where people still can see patients? And then another, where do recruiters find you? LinkedIn or somewhere else?
Yep. So most of mine occurs through LinkedIn. And in fact, I would say that that's actually where all of mine has occurred, has been through LinkedIn. So I definitely think that's a great avenue for, for networking. And sorry, what was the first question? Completely blanked.
And then the other was, now I blanked too. Are there genetic counselors in industry that also see patients?
Yes, actually. So every company is a little bit different, but as an example, my next position, the NextGen MDX. So we actually had two departments of genetic counselors at NextGen. So again, I did not see patients because I was working as a medical science liaison. So my specifically was what I've already mentioned. It was to work with hospital systems, physicians, and but then we had a separate team that worked for NextGen. So they were completely, full-time, paid by NextGen, and their job was to see patients that had proceeded with testing or were considering proceeding with testing through the company. And so again, genetics has gotten quite complex. And so, even though many physicians or other ordering healthcare providers recognize the importance of genetic testing, many of them were not trained on this at all, or they were trained on it 10 years ago. And again, so much has changed in the past 10 years. It's difficult for me to keep up with all the changes, even though I live it and breathe it every day. And so some laboratories do, again, offer genetic counseling services on behalf of the laboratory to patients. And, even this was before COVID and all of that was virtual. So yes, there are opportunities to, work in industry for a laboratory or for a private company, but then also keep that patient care. I imagine it's typically done virtually. The counseling is probably a little bit different because again, you're interpreting results or doing, benefits, risk limits, limitations, benefits of the particular test if they're on the fence about whether or not to proceed to it, as opposed to making, medical advice, which was something that I did do in clinic. But nonetheless, it is definitely that patient care. There are those patient care opportunities in some industry positions, yes. There are also genetic counseling companies that provide virtual genetic counseling services, just, as their own, like, what's the word I'm looking for? Well, virtually. So like almost like an on-demand, I've had genetic counseling or I'm considering genetic testing. Here are my results, and their healthcare providers can refer them for that virtual consult, even though they're not affiliated with a particular laboratory.
It's like telehealth companies and
Exactly. Mm-hmm. All right. Should I keep?
Yeah, keep going.
Okay. So I'll speed up just a little bit since we're getting to the last little bit of our time. So a position that I had, again, same role, but I actually went back to my prenatal or the high-risk pregnancy roots from 2018 until last summer. So again, I was at a very small company called NextGen MDX. and worked in a few different areas of genetic testing. One is something called non-invasive prenatal testing, which is a relatively new game-changing test offered to now every woman in pregnancy. But it's a very accurate blood test that can screen for Down syndrome or other similar abnormalities. And again, we think about Down syndrome as being a genetic condition, but it is a genetic condition that almost always occurs by chance as opposed to being passed through families. So this is something that is typically offered to every woman during pregnancy. Then we can look at things like carrier screening. Every single person on this call is a carrier for 8 to 10 or more genetic conditions, but of course, being a carrier is silent. You don't express the disease or the condition. So you wouldn't know if you're a carrier for that condition until you proceeded with molecular testing or genetic testing. And so carrier screening was something that was offered at the previous company. And then of course, if you are a carrier for something, then your reproductive partner, the person you are going to have a child with, would need to be tested for the same condition. If you're both carriers, then at that point, there's a risk for the pregnancy or the future child to be affected. And then NextGen also did a little bit with hereditary cancer genetic testing. So these were individuals that at the time did not have cancer, but maybe there was a strong family history of cancer. And we know that about 5 to 10% of cancer cases are due to an underlying genetic mutation that a patient is born with. And so it puts them, it does not, again, guarantee that they will get cancer, but it puts them and their other family members at a higher lifetime risk of developing cancer.
And then a question, before we move on to your next role, how did you choose a specialty and did it become clear to you during your master's?
Great question. So it partially became clear to me during my master's. So I knew that I wanted to work, especially with clinic, I wanted to work in a setting where I had autonomy. And so again, in prenatal, in cancer, in neurology and cardiology now, you are working with a bunch of very smart individuals, cardiologists, neurologists, but you are the genetics expert. And so I wanted to be in a role or in a position where I would be considered that, well, as I just mentioned, that individual with the expertise in genetics. So I was seeing patients on my own. I was doing my own documentation. As I mentioned, I was ordering the testing on my own. And then in any field, there's going to be collaboration. So of course, if something comes back positive and we find out, hey, mom's at risk of abnormal bleeding because of this genetic condition, well, then suddenly my test now has ramifications or implications for maternal fetal medicine who might need to manage a previously unknown risk of hemorrhage during delivery. So all of that to say, I knew that I wanted to work in an area where I would have that autonomy. And there are certain settings where you're working with a medical doctor, a physician who is also trained in genetics. And so in my experience, a lot of those instances, there wasn't that autonomy. You were always in the room with the doctor. And I just wanted to, feel like my own practitioner, my own clinician. In terms of, to be completely honest, I really have loved almost every I have loved every specialty in which I've worked. I've done a lot, prenatal, carrier screening, neurology, cardiology, cancer risk, and now current role is something completely different, whole exome sequencing. That's actually, I'm skipping ahead just a little bit, but one of the things that I love so much about genetics or genetic counseling in general isn't just the diversity of roles. So again, there's clinical that I've talked about, there's industry, and even within industry, I have genetic counseling colleagues that are not medical science liaisons. They see patients within industry, or they do research or clinical trial development. but there's also tremendous diversity in what area of genetics. And, so if you get in one area and it's not super fascinating, or even if you love it for 5 or 10 years and then want to change it up, you're trained as a genetic counselor. And when you pass that board exam and get that CGC, that means you're qualified to do any specialty within genetics. And so I love that there's constantly learning. I love that I'm always having to sit down and read a new article or learn about a new gene or learn about a new specialty. So I guess that's the best way to answer the question is you don't, if genetics is a passion and you're unsure about, do I want to try this? Do I want to try this? You're not stuck in one thing. It's not like medical school where you have to decide, I want to be an oncologist. And then, that's your track unless you go back to school. You decide you want to be a genetic counselor, and then you design your own map and your own trajectory. Was there another question, Megan?
I think some of them are more general. So if you want to talk to us about your current role, we have time for questions at the end. We can bring those up.
All right. So I'll just finish with this. I've been working for almost a year now at a company called GRAIL. And so, everything that I've discussed so far in genetics is looking to diagnose, genetic conditions. So again, I talked about Down syndrome, I talked about seizures and epilepsy, but now we're starting to really further advancements in genetics. We're realizing that genetic testing can be applied not just to diagnosing genetic conditions, but also screening for genetic abnormalities associated with very common conditions. So again, we think about cancer, and I'm sure there's not one person on this call who hasn't been personally impacted by cancer. Cancer is one of the leading causes of mortality and morbidity. So, health complications in the United States. And right now, we have a handful of recommendations for cancer screening, mammograms for women, cervical cancer screening for women, colonoscopies, but really that's only a handful of the cancers that are diagnosed each year. And unfortunately, even though lots of research and lots of new treatments are being developed in cancer, at a very rapid pace, most of that money is going into the treatment of stage 3, stage 4, so later more advanced cancers. And what we want to do, or what GRAIL, where I work, has wanted to do is take the lessons we've learned from something like mammogram, where we know there's better prognoses, right? If you diagnose something at stage 1 versus stage 4, not only is there likely a health savings benefit, it's not as expensive to treat a cancer that's spread as it is to treat at stage 1. But there's also a major, and more importantly, a major impact on outcomes. So again, diagnosis at stage 1, breast cancer, 99% chance almost of, 5-year survival, versus stage 4, where, there's a significant mortality. And so again, right in the current landscape, about 75 to 80% of cancers that are diagnosed in the United States today, they're diagnosed in cancers that are not screened for. So things like pancreatic cancer, ovarian cancer. And since we're not looking for them, they're typically diagnosed at a later stage. And so GRAIL has developed a blood test where we are looking for molecular, so in other words, genetic abnormalities associated with specific types of cancer. So with one blood test, we're able to screen for more than 50 different types of cancer at once. So again, this is a brand new application of genetic testing that's just getting off the ground this year. If you're interested, again, I'm talking on behalf of myself, not on GRAIL, but if you're interested, grail.com actually has publications from the end of last year, beginning of this year, that talk about the process of screening for cancer through blood and how many additional cancers we hope to be able to detect at an earlier stage and improve those, cancer outcomes, not just for breast and cervical cancer, but for many different types of cancer. And so, speaking of transitions, I just thought this was an opportunity way too good to pass up, being in something that I hope will be a paradigm shift in terms of the interception of disease, and it'll be a unique application of genetics that again allows for not just diagnosing, but also an impact on outcomes, which is really exciting for me. So, again, I hope that what you can see in just, the snapshot of what I've done for the past 10 years is, I'm very passionate about the patient care aspect. I think the enhanced training we get with bedside manner, and then that skill set can be transcended and applied to even industry positions. With genetics, it's a fascinating field where you're encouraged to learn every day. So if you, a big science geek like me, again, this is a field where, every morning have my cup of coffee and I'm reading what else do I need to educate myself on today. But then most excitingly, we talk a lot about diversity, and we want a diverse group of individuals representing genetic counselors and representing patients who will see genetic counselors, but also there's diversity within the field itself. And so with this master's degree, not only can you do roles with managed care or insurance, which I didn't even touch on, but there's leadership positions within hospital settings. There's other roles within industry, clinical positions. And then as you see, even within those, if you're the most interested in cancer, but then want to try neurology or switch 10 years down the road and try something different, all of that is at your fingertips with this career, which again is one of the, I think, most appealing things for me about the genetic counseling profession.
Definitely. Well, we really appreciate your time, Michael, and you've shared so many interesting experiences. We're still available for a few minutes if there are other questions, a couple more that have come in. I don't know if you still have time, Michael.
Yes, absolutely.
All right. One that came in and I sort of addressed in the chat was just whether there are international training programs available. And I just commented that I knew that there were and sent a paper over. I don't know if anyone else has more to say about that, Ellen or Michael.
I'm not the best person to ask. There are. I know there's at least Australia, Canada.
And some people travel and, to do their training and then go back home. But in the chat, I dropped a paper just kind of on the global state of genetics, where genetic counselors are from and practicing. It also comments on where some programs are. There's also a question on, you talked a lot about your training program preparing you for multiple specialties. Did you feel like you were pretty confident that you were prepared enough for each specialty? Like you had enough knowledge of all of them, or was it more on the job training?
It's both. And, so when I say this field has evolved, I mean, even the topics that I now need to know have evolved. So, I was not taught neurogenetics. I really wasn't taught cardiogenetics. We weren't taught whole exome sequencing at all. But you're taught, the fundamentals of genetics apply to any field, so how to interpret a genetic test result, or how to or the differences between the different methodologies, so the different ways to do genetic testing. So the fundamentals I felt very prepared for when I left when I left grad school. Certainly whenever I switched to industry, there was some on-the-job training, and then there's also, when I switched specialties, there's some on-the-job training, and there's also some, self-didactic, I think, that takes place. So, again, as I moved into cancer, again, I'm familiar with genetic testing and those fundamentals, but new genes have been discovered in the past 5 years. So I had to, I sat down and I looked at the papers myself to educate on those new genes I wanted to be aware of. But then, again, you are working in cancer, and we're not oncologists, we're not maternal fetal medicine specialists, but I think there is an importance to kind of understanding some of the basics of what does an oncology treatment pathway look like, or what are some common indications for maternal fetal medicine. And again, those you just learn by being on the job. So again, I was never taught, what classifies as a stage 1 cancer versus a stage 2 cancer. But I was taught where to look to learn that information. And now that that's applicable to my day-to-day, I've sat down and started learning it. So it's a little bit of both.
And I think that's what makes a lot of us really enjoy this profession. From Michael or Ellen, Danielle, anybody, what kind of positions are you aware of for genetic counselors in public health or policy making?
Ooh, I know that they exist. I know I can speak from North Carolina's perspective. We actually have, I believe, 5 state funded or state supported public health genetic counselors who do community outreach events or even go to patients' homes in more rural areas and provide genetic counseling services. I have never looked into those roles. So again, I'm not super certain as to what qualifications they look for or anything along those lines, but I do know that they exist and that there is a demand for them.
I think anyone having both areas of expertise, like in public health and policy, and also in genetic counseling, would have some unique opportunities. I know there are people based in Washington who help legislation push forward, and you can imagine that having the skill set and the knowledge of being a genetic counselor could be very helpful in crafting that legislation. I also know that there are committees within NSGC, our National Society of Genetic Counselors, on public policy. And so that might be a good way for people to get started. But I think those opportunities are growing.